Blaine Higgs is the Premier of New Brunswick. He'll, of course, be on the First Minister's call with the Prime Minister to discuss an increase in health transfers. Premier Higgs, thanks for joining me tonight to talk about this. Good to see you again.
Nice to be here, Peter.
Look, just before we get to the health transfers issue, let's talk a little bit about vaccines. Are you clear on what the federal plan for vaccination is?
Well, no, I can't say as I'm clear, but I'm optimistic. I feel good that we actually have vaccines that are available. 7, but 4 that are pending very quickly. We did have a good call last week that basically outlined that we should see, vaccines start to roll out in the early January and through the first quarter, and we're looking at potentially treatment for 60,000 citizens on a per capita, looking at what their estimates are right now. So that's not confirmed, but that's what it looks like. And we're working through the logistics through December to figure out how we might distribute that and where the priorities would be. So I think it's good news, because 2 months ago we were hoping to have a vaccine. So I think we should be appreciative that we actually have some on the way.
What are the big questions you still need answered, or is there a big question you still need to get cleared up from Ottawa?
Well, the big question is the timing of delivery so that we can actually plan the distribution and line up the actual vaccination. So we need to know how much we're going to get and when it's going to arrive. And that to me is more important, really, to know in December, so we can let the public know. I don't think there's going to be a mass, run to get vaccinated. I think it'll be balanced, but it'll particularly be balanced if people know it's coming.
Right.
And we line out who's going to get what and why first. Basic to the vulnerable population and what's needed. And so I think that's what has to be is a good communication strategy of a vaccine that's going to be well rolled out in a timely fashion and available to everyone.
All right, let's talk health transfers. Premiers say they want $28 billion, you and your colleagues, more in federal health transfers. No mention of that in the fiscal update. On top of that, the Prime Minister made the case today that, look, the federal government's already covering 80% of the cost of the emergency spending for the pandemic, suggesting he's doing more than his part to offset your health care costs. Does that suggest to you that no permanent increase is coming?
Well, it is concerning, Peter, that does give that sort of implication, that's just the path forward. We'll know on December 10th. We're meeting with the Prime Minister, all the premiers, territory leaders to discuss particularly the Canada Health Transfer. But I got to say that money that's coming in, I appreciate as much as anyone through this pandemic, and the federal government's been very supportive and reactive in spending money across the country. But we're at a point now that we're focused on recovery. We're focused on putting dollars where they're really needed. It isn't about a federal political agenda. It should be about provincial needs, needs that we're all aligned on in this case of a transfer. So when you see the economic update yesterday and the federal spending that's planned, I mean, you have to say, okay, well, why don't we channel some of that money into specific requirements that we know we're going to have years to come?
When you see the federal government promising to spend up to $100 billion on a recovery plan over the next 3 years that includes national child care, more money for climate infrastructure and so on, but no commitment to more health transfers, what's your reaction?
Well, that's exactly my concern, is that we need to manage what we have and then build on making it better or adding. But at this point, we have a healthcare system that is increasing in demands daily. We've seen that across the provinces, some more so than others, based on certainly the COVID needs, but also based on the demographics. And we need to address that. So let's not ignore the challenges that exist every day, every year, and try to invent something new. Let's get a good handle on a quality healthcare system that we know is sustainable in all provinces for the future.
Right, but
that is the criticality of this.
Are you worried where this might be headed is that the federal government can point to the pandemic and say, look, the funding formula for health transfers will stay the same. If we run into a particular problem where you face a big, a big hit to your finances because of something like a pandemic or something else, then we'll look at that in individual cases and look at perhaps boosting funding that way. Is that okay with you?
Well, it's not okay. It's not reassuring in the one sense, but we're hoping not to have a pandemic every 6 months or a year or 100 years for that matter. But it's like we know the situation exists today on our health requirements. So let's address that. Let's even have flexibility in what we're currently received in federal funding in other categories. So we and I've said that over a lot of things. If we're looking at money for long-term care. It's not like we all need to go out and build a whole bunch of new buildings, because we know that people want to stay in their homes longer. They want the health care to allow them to do that. That's what I'm
There-
talking about. Let's map it out for each province.
There was a new $1 billion fund to help provinces improve infection protection and controls in long-term care homes. That was announced in the fiscal update, but there will be strings attached. The federal government would have to approve how you use that money. And so I'm wondering if that also might concern you, that if there is going to be an increase in federal health transfers, it'll come with a lot more conditions.
Exactly. That is my concern. We know what our problems are now, and one size doesn't fit all. And on the case of just building more nursing homes or more infrastructure spending on things that we don't particularly need, and yet and we want to provide a service to people where they live and for as long as we can, because that's what they want. Let's have that particular discussion so we can actually use the dollars for what the provincial priorities are. This isn't about an election. This is about what we've learned through COVID, how much better we can be, what challenges we have, not only as a result of COVID, but on an ongoing basis. And the federal government recognizing that. I don't know that we've ever had a case where all premiers have asked for something so specific, so direct, that could have been built into the economic update. It was disappointing not to see it there, not surprising given the lead up, but disappointing.
All right, New Brunswick Premier Blaine Higgs. Always good to get your perspective, Premier, and we'll talk again. Take care.
You as well.